Hi, my name is Megan Hughes, and I want to tell you about a country that's very special and it struggles with healthcare. Guatemala. It is considered a third world developing country and just recently ended a civil war in 1996. Guatemalan people struggle primarily with finding education and work. Their lack of education and work lead to countless struggles, one being healthcare. According to the National Encyclopedia, the average number of years of schooling in 2011 was 4.1. Illiteracy rates in Guatemala are among 60% of the people. The lack of education leads to poverty. The average pay wage for agriculture workers, which makes up 1.7 million people, is 9.85 PU per 8 hours, which equals $1.29 a day, according to the wage administration. We must keep in mind that agricultural goods are the major export and source of income for the country. If 1.7 million people, primarily men, are working in the fields, providing for their families on $1.29 per day, what major source of income do families have? The answer is none. Guatemala is very populated, and as of July 2000, Guatemala's population was estimated at 12,600,000. Approximately 480 people per square kilometer, which is 1,250 people per square mile, making it the second most densely populated nation in all of South America. Guatemala also has the highest growth rate in Latin America with 2.9% a year. Families typically with upwards of 5 children per Guatemalan woman are suffering with malnutrition and sickness with no access to health care, according to the National Encyclopedia. More than 40% of the population does not have access to health care services. If the other 60% of people did have access, financial constraints would limit their options for treatment. Treatment for diseases such as HIV/AIDS, malnutrition, simple infections, childbirthing complications, diabetes, parasites, pneumonia, typhoid, tuberculosis, malaria, rabies, yellow fever, tetanus, and cholera. Diarrhea is the leading cause of death in children under 5 years old. As of 1999, 73,000 people in Guatemala lived with HIV/AIDS, making 1.38 people per 100 HIV positive, according to the World Press. All of the preceding diseases can be prevented and or treated with proper care. The country of Guatemala has 16,000 medical clinics with a present estimated population of 15 million, staffed with volunteers, nurses, and physicians. Those numbers average approximately 1 physician per 1,000 people. 70% of physicians live in Guatemala City, making the ratio 1 to 200. But in more remote and poorer areas of the country, the ratio is as high as 1 physician per tens of thousands of people. Present Guatemalan healthcare has 4 parts. One part is the public healthcare system. 90% of the population falls into this category. The public system, it sounds perfect because it provides free healthcare for all, but it's deceiving. Public hospitals are often overcrowded and understaffed. Patients are often turned away and asked to return the following day, after they paid a heavy bus fare and waited in line for hours. Communication is poor within this system, as patients may never receive the diagnosis or proper treatment. The second system are private clinics and hospitals, where the wealthiest 5% of the population pay out of pocket for treatment. It's always expensive, and like the U.S. healthcare system, it's a luxury. 3. The Social Security system. People only receive Social Security benefits and healthcare if they have a legitimate job. Legitimate jobs don't include majorities like farmers, drivers, maids, sellers, and markets. And 4. The military system. Healthcare is supposedly provided for veterans, but review of the system is prohibited and remains undisclosed. The system is often forgotten, and healthcare is not taught. With all of this being said, what can we do about it? It is easy as a wealthy American to go to Guatemala and do the dirty work of paying for healthcare and providing those services, but does that fix the underlying issue? The underlying issue is education. It is a cycle. No education means no money, which means a low-paying job, no money to provide for the necessities, and sickness, death, occur. We need to provide practical education to the people on how to care for themselves, to have sustainable living, to have healthy eating habits, and the basic knowledge. It can be hard and discouraging as an American to see such poverty and feel as if we can't do anything but that is wrong. Making a small impact leads to great change. Here's an example. Paying for a young girl to go to school enables her to receive at least one healthy meal a day. She can gain knowledge and get a higher paying job. She's then able to work in that fractional job, typically in a city, where the wages are greater, and provide for her family financially, where they could have been able to produce. So here's my mission. Healthcare in Guatemala is corrupt, poor, and unsustainable. People are dying every second from illnesses that could have been prevented with simple education and funding. It is not time to wait around for someone else to address these issues. It's time for us to make a small impact so together we can. Bye.